We are positioned uniquely in a group of people who've been forgotten, a group of people who've been neglected.
The benefit for us being in these communities is being able to fill that gap, that void.
One of the things when I was choosing a residency was being able to make sure I was going to a place that's going to be a resource for that community. And I knew where I came from. Oftentimes we couldn't pay for things. Coming to a place like Cahaba, them having that saying, hey, we will help you regardless of your inability to pay. I knew that's where I was supposed to be because I knew that's what we're gonna need in order to make sure we're providing access, making sure we're doing what we're called to do, so.
Cahaba Medical Care has a dual mission toward patient care and patient service and training the next generation.
The heart of what we do here is all about recognizing tremendous unmet needs in our communities, and let's try to be there. Our people are coming from a background where the reason they're doing medicine is that they want to make an impact in a community. Some of the teachings of Jesus where he would say, be a good neighbor, and what does that look like? For our residents, as they are finishing up with residency, that they would be very much attuned to where are the needs.
We've watched Jesus' footsteps in healing people and loving people unconditionally.
It's allowed me to grow in huge ways in my relationship with God. In every part of my day, I really get to be on mission for the Lord.
We want to be a place of love, peace, and justice for our patients in a very holistic way.
We're always encouraging one another to pray, to engage in those conversations, to figure out how to get to know them on a deeper level.
We have worked really hard to kind of put together a panel of services that people that we live next to need in order to be healthier, happier individuals.
Our mission is different in that it's not just about the medical training, it's about the community you're serving.
I really wanted to go to a program that was serving really difficult areas to access. Cahaba Medical Care was truly my dream. It was my vision for something I would want in my community. It was a program that was truly speaking to the needs of an underserved area.
We are a federally qualified health center, which allows us to do a lot of things for folks that are underserved, underprivileged, with insurance, not with insurance. It allows us to connect them to a lot of resources otherwise they wouldn't have.
If we weren't an FQHC, we would not have nearly as rich an environment to train residents in. And if we didn't have the training, we would be less of an FQHC. We recruit better because people who really love primary care want to teach it. They want to pass that on.
One critical ethic that we have at Cahaba Medical Care is that we're involved in our community, we live in our community, we're engaged in the community.
Us living in this community has almost been more transformative than being a resident. I think it's really grown my ability to empathize with my patients, kind of meet them at the heart level of what life looks like for them.
Getting a unique perspective of the things and challenges your patients face allows for better care.
This is exactly what I wanted, in a program, and this is exactly where I wanted to be.
The residency program is truly every piece of medicine that you have ever studied. I wouldn't trade it for anything.
Come and invest your life, invest your career. There are things to do professionally and medically in these communities that's just absolutely necessary for us to move the needle on the healthcare disparities in this country.